I'm Katie Hechuela. I'm a nurse practitioner at Gastroenterology Associates of Colorado Springs, and I'm going to talk to you today on how to complete the small intestinal bacterial overgrowth, or SIBO breath test. Small intestinal bacterial overgrowth, or SIBO, is a very common condition that causes irritable bowel type symptoms: gas, bloating, constipation, diarrhea. So this breath test is a tool that helps us to determine if this condition is causing your symptoms. This is a test that takes about 3 hours and is done in the comfort of your own home. It's very important that you avoid any probiotics and acid suppression medication like Prilosec, Prevacid, Pepcid, Nexium 2 weeks prior to completing this test. It's also important for you to avoid any antibiotic use at least 1 month prior to completing the test. If you have any specific questions regarding your medication, always check with your provider before completing the test. The day prior to the test, you'll complete a 12-hour preparatory diet as well as a 12-hour overnight fast. In the morning before the test, you want to make sure you brush your teeth really well, and you can also rinse with a mouthwash. This helps to reduce any high gas levels that is coming from bacteria in your mouth. You will receive your small intestinal bacterial overgrowth breath test kit from Gastroenterology Associates of Colorado Springs. When you receive this, you'll also sign a consent form. Please ensure you read all directions when you receive your test kit and complete the test as soon as you are able. Your test kit contains the following items: 10 test tubes, 10 labels, lactulose substrate, a collection device, preparatory guidelines, and instructions. After completing the preparatory diet, which includes chicken, eggs, broth, white rice, water, and salt and pepper, you will be ready to complete your 12-hour overnight fast. To get accurate results, it's crucial for you to follow this diet and the overnight fast. Make sure you have everything in your kit and it's set up and ready to go. Mix up the lactulose solution with 8 to 10 ounces of water and set aside. Don't drink this yet. Now you are ready to collect your baseline breath sample. Put your mouth over the collection device and start breathing out. Mid-breath, put the test tube onto the needle for 1 to 2 seconds, then take the test tube off the needle before you finish your breath. Let's review that again. Look how she inflates the bag fully before puncturing the test tube with the needle. Then the test tube is removed before the breath is finished. If you're older and you need assistance, it may look something like this. Put your mouth over the collection device and start breathing out. Mid-breath, put the test tube into the needle for 1 to 2 seconds, then take the test tube off the needle before the breath is finished. After you complete your baseline breath sample, write the time on the label and apply it to the tube. Set it aside not to get mixed up with the other tubes. Now it's time to drink your prepared substrate solution. After you drink the solution, set your timer for 20 minutes. Collect your second breath sample 20 minutes after you drink your substrate solution. All samples must be completed at 20-minute intervals until all 10 samples have been collected. If you complete a late sample, please ensure the next sample follows the original time schedule. The breath test takes 3 hours to complete. After you have completed and labeled all of your samples, put the test tubes back in the bubble wrap bags and place them in the box. Return them back to Gastroenterology Associates of Colorado Springs at 1699 Medical Center Point. Take them to the front desk on the second floor. Please ensure we receive your completed test within 7 days of collection. Thank you so much for watching. We hope that this video will help you to complete your SIBO breath test. If you have any questions, please reach out to Gastroenterology Associates of Colorado Springs.